Vitamin B12 deficiency has long been associated with physical symptoms like fatigue, numbness, and anemia, but what often escapes mainstream attention is how profoundly it can affect the mind. In fact, low B12 levels can masquerade as psychiatric disorders with surprising precision, mimicking depression, anxiety, psychosis, and even dementia. This overlap between nutritional deficiency and mental illness presents a diagnostic blind spot with serious implications, particularly in vulnerable populations like the elderly, vegetarians, and individuals with malabsorption issues. As a result, many people suffering from a reversible, nutrient-based condition may instead be misdiagnosed with chronic mental health disorders, leading to unnecessary medication and prolonged suffering. The mind-altering potential of B12 deficiency lies in its role in neurochemical balance and brain structure maintenance. B12 is essential for the synthesis of acetylmethionine, SAMe, a methyl donor required for producing neurotransmitters like serotonin, dopamine, and norepinephrine. When B12 levels drop, these pathways falter, and mood disturbances follow. The emotional flattening, despair, and loss of motivation commonly seen in depression can emerge simply from disrupted methylation cycles and neurotransmitter shortages. Yet because these symptoms are not accompanied by physical signs early on, the root cause can be easily overlooked. More strikingly, severe B12 deficiency can produce psychiatric symptoms that are mistaken for schizophrenia or bipolar disorder. Auditory hallucinations, paranoid delusions, mania, or bizarre behaviors have been documented in clinical literature, often in patients with no prior history of mental illness. These symptoms may improve dramatically with B12 therapy, underscoring the idea that cobalamin deficiency is not just a metabolic issue, but a neuropsychiatric chameleon. The brain's reliance on methylation and myelin integrity means that both communication between neurons and the neuron's physical stability are compromised, setting the stage for a cognitive and emotional unraveling that looks psychiatric but is biochemical at its core. One of the more tragic aspects of this phenomenon is its impact on older adults who often exhibit symptoms resembling early dementia. Memory lapses, confusion, irritability, and slowed thinking, all classic signs of cognitive decline, can, in some cases, be entirely due to insufficient B12. This misdiagnosis may lead to treatment with anti-dementia medications, while the true underlying issue remains uncorrected. Research shows that early B12 supplementation can restore cognitive function if the deficiency is caught in time, but the longer it persists, the more likely that neural damage becomes permanent. In this way, a preventable and treatable condition can evolve into irreversible neurological decline simply because its psychiatric mask is mistaken for something else. The risk of misdiagnosis also extends to younger individuals, particularly those with dietary restrictions. Vegans, vegetarians, and those with chronic gastrointestinal issues such as celiac disease, Crohn's disease, or post-surgical complications may not absorb enough B12, even when consuming what appears to be a normal diet. The resulting mood and cognitive disturbances may be dismissed as stress, personality disorders, or burnout. For individuals already experiencing emotional instability, this nutritional gap can act as an accelerant, deepening the psychological spiral and complicating recovery. Complicating matters is the reliance on standard serum B12 tests, which often miss functional deficiencies. Someone may have a B12 level within the normal range, yet still experience neuropsychiatric symptoms due to low intracellular availability or poor methylation efficiency. This is where measuring methylmalonic acid, MMA, and homocysteine can offer greater clarity. Elevated levels of either indicate a bottleneck in B12-dependent pathways, signaling a functional shortfall that the basic B12 test may not catch. Fortunately, the prognosis for B12-related psychiatric symptoms is often excellent when diagnosed early. High-dose supplementation, especially with methylcobalamin, can lead to rapid improvement in mood, cognition, and behavioral stability. Unlike many psychotropic medications, B12 has virtually no side effects, is non-toxic even at high doses, and can be administered orally, sublingually, or via injection depending on absorption status. In many reported cases, patients previously misdiagnosed with psychiatric illness saw complete resolution of their symptoms after B12 repletion. This reinforces the idea that, for some, mental illness may not stem from a neurotransmitter imbalance per se, but from a fundamental failure to produce those neurotransmitters due to nutrient deficiency. This silent masquerade by B12 deficiency teaches an important lesson. Not all psychiatric disorders originate in the mind. Sometimes they begin in the gut, the blood, or the biochemistry of a single neglected vitamin. In an age of rising mental health challenges, reintroducing basic nutritional awareness into psychiatric evaluations could save countless people from misdiagnosis and unnecessary treatment. It also serves as a reminder that mental health is inseparable from physical health, and that something as simple and overlooked as vitamin B12 may be the key to restoring balance when the mind begins to fray.